Hello, my name is Glenn Pierce. I'm the Vice President of Medical for the World Federation of Hemophilia and am a member of the ISTH Gene Therapy Education Committee. I'd like to talk about an abstract that was presented in poster form at the recent ASGCT meeting entitled Utilizing Apheresis to Remove Neutralizing AAV Antibodies in Patients Previously Excluded from Gene Therapy. First author is Jonathan Foley, and it came from Freeline and Amit Nathwani. They wanted to take a good look at plasmapheresis as a technique or technology to see if they could diminish the amount of pre-existing antibody in patients that would be otherwise eligible for AAV gene therapy, and in this case for hemophilia. What they have done is to take the technique of plasmapheresis and see if they could utilize that to diminish the antibody levels to AAV in prospective patients. Plasmapheresis has been utilized routinely in clinical medicine for about 70 years now and has been very effective at removing autoantibodies in a number of different autoimmune diseases, such as Guillain-Barré syndrome, myasthenia gravis, chronic inflammatory demyelinating polyneuropathy, and several others where it's been very effective in ameliorating the disease symptoms. It generally has involved daily administrations of the technology over a 1 to 2 hour period of time in which the plasma is exchanged and the antibodies, as well as many of the proteins in the plasma, are removed from the patient. The problem with it is that the antibodies will come back within the day. They'll come out of the tissue reservoirs and repopulate the circulation. And so what's been done has been to do a series of these on a daily basis, up to 5 for 5 days. And that's the approach the group took in this case as well. They gave 5 sequential administrations of plasmapheresis and demonstrated a significant reduction in the amount of pre-existing AAV antibody, up to about 94%. One major issue is whether or not that's enough. And for patients who have high titers, the removal of almost 2 logs is a significant amount, but will not be sufficient for patients who have higher titers. So what they've done is effectively demonstrate that you can move the bar. And by moving the bar, you're making more patients eligible for the AAV gene therapy than otherwise would have been. There are other methods that also could be utilized. One is immunoaffinity chromatography. That has also been explored, which more specifically through protein A or protein G columns removes just the IgG. That also requires repeated administration. It is more efficient than plasmapheresis, but it hasn't been really demonstrated in clinical trials yet to be effective in opening up the patient population that would be eligible for AAV. So this is a good example of an approach to take to try to make AAV available to a wider population of patients, and we'll need to await clinical testing in an actual trial. Thank you.